Welcome back to Parent Financial. This is John.
This is Frank.
And today we're going to talk about long-term care.
Yes, as you might know, November is Long-Term Care Awareness Month. And did you know that over 70% of people who are over 65 need to use long-term care at some point after their retirement? But only 10% of those people have long-term care. And the cost for long-term care right now on average is about $4,000 to $5,000 a month for home care. Wow. Now, if you use private services, it's going to be double. So let's get started into it. And what is long-term care, Jonathan?
Yes, so Frank, that's some pretty alarming statistics. That's a lot of money to pay. And my family, my grandpa was paying $5,000 a month for an unlicensed person to come and take care of him before he passed away. So your statistics are pretty right on point. But what is long-term care? Basically, long-term care is when you get to the point where you're chronically ill, you're disabled, you cannot take care of yourself anymore, and you need somebody to take care of you over like a 90-period day that you cannot take care of yourself. That's when you get into the point where it's long-term care. If you qualify for long-term care by not being able to do 2 out of 6 daily living activities.
And I hear about those 6 daily activities, ADL. Could you share with us what they are?
Yes. So the 6 ADLs is bathing, continence, dressing, eating, toileting, and transferring. So if you cannot do 2 out of those 6 things, you will qualify for your long-term care.
So what do people use long-term care for?
Yes, so when you have long-term care coverage, you use it to pay for either your home care services. So if you cannot take care of yourself, but you feel like, hey, you know what, I don't want to really go into a nursing home. I want to be in my house, be in my home where I'm comfortable, and have someone come and take care of me. You can use the benefits at home. It could be with a nurse, or it could be with your friend or family. It doesn't have to be a professional. The second way you can use it is that you go to a professional facility, like you said, where you have more private services. Maybe you have a private room or you share a room with somebody, and you use those funds from your long-term care policy to pay for those nursing home costs.
I see. Now, there's an assumption that my health insurance is supposed to pay for your long-term care?
That's a great assumption, and it's absolutely wrong, Frank, because your health insurance does not cover your long-term care. Your health insurance just covers you for preventative care services before you get sick, and also when you are very sick and your life is in danger, they will take you to the hospital and save your life. But after they're done saving your life, and now you have to go home, and maybe you're not fully recovered yet, then you have to take care of yourself. And sometimes that recovery period could be more than 90 days. And if it's more than 90 days, that's when your long-term care kicks in. Now, there are some cases where if you're on Medicare, you're over 65, you're on Medicare, Medicare only covers you 100 days, Frank.
Yep.
After 100 days, you're on your own. So it doesn't mean that your health insurance covers you, because it's very limited. The final way that health insurance could pay for it is if you're on Medicaid. Medicaid means that you're very low income, qualify with the state, you don't have enough assets, you don't have enough income to take care of yourself, then the state will take care of your long-term care needs, but not everybody qualifies for that.
I see. Now, if health insurance doesn't pay for my long-term care, how do I pay for something like this?
Well, I'll tell you, most people, Frank, because they don't know about the long-term care insurance, most of the time, the number one way people pay for it is they have their family pay for it. The family will carry the burden to pay for it themselves. My family, just for example, they have to pay out of their own pocket for my grandpa's long-term care needs because he didn't want to use the states and he didn't have the insurance. Another way is using their retirement money. But the problem with that is that when you take your retirement money out, you have to pay taxes, right? So you're losing money to taxes, and now you're using that money that you're supposed to retire and enjoy to pay for your long-term care needs. It's not very efficient. The last way people pay for their long-term care normally is using their house. They'll pull equity out of their home, their hard-earned money they paid into their house, like 30 years to pay it off, now only to owe money on it all over again by using their home to pay for the long-term care.
Wow. So those options, I don't know about you guys, but they seem to me pretty inefficient. Is there any efficient ways that we can do to pay for our long-term care?
Yes, and that leads to what we're doing today is that we want to educate more people about how long-term care insurance works. So basically, you're leveraging your money to have the insurance company pay for your long-term care needs. If you plan early enough before you're sick, maybe you put $1 in and it could be worth $4 to $5 later on when you use your long-term care policy, rather than taking 1 for 1 out of your home, or 1 for 2 out of your taxes for your retirement account. You can leverage up your money using insurance. So you got to make sure that you can plan ahead for that. There's 2 ways you can generally buy it. Is either you buy life insurance, Frank, and you add on the long-term care rider on it, or there are linked benefit policies where they specialize in just selling the long-term care for you, and it lasts your whole lifetime. It's not like your traditional ones where you use it and then if you don't use it, it goes away.
Okay.
Right? So those are usually the 2 most efficient ways to handle your long-term care.
I see. Now I have one last intake. As you might know, there are some states in the country that are starting to mandate and impose a law that requires people to have long-term care. What do you suggest people do?
I suggest you get educated first, right? Understand what the state requirement is and see, okay, what is your budget and how much the state is requiring, and see how much can you afford to buy on your own versus how much you can get from the state. Because if you don't get it, they're going to penalize you based on your income, and the program that the state is going to give you is going to be like a bare minimum program. So it's not going to be a lot of benefits. It's not going to, you can't take it with you for the rest of your life. When you stop working, it goes away.
I see.
Right? And so you rather put your money to something that you can have for the rest of your life. And if you plan early enough, it's very cost efficient to do so. So I recommend that you get educated on it. Talk to your insurance agent advisor. Talk to us. We're experts on this field. And get yourself a long-term care policy right away before states start imposing on it and you've already ahead of the game. Another suggestion I would do is, hey, why don't you join us? You know people that need long-term care. Join us, our firm, to help other people get their long-term care and make money along the way too.
Yep, and there you go. That's long-term care in a nutshell for you. Like Jonathan said, if you know somebody or if you're still young and healthy, get long-term care before it's too late. Contact us, drop a comment below or give us a text or give us a phone call, and we'll be happy to help you.